Okay, I'm conscious of the time. It's just gone 10 o'clock, so can I open the meeting and welcome everybody to this meeting of the Healthier Communities Overview and Scrutiny Committee. Can I welcome the people that are going to be sat in the web, watching the webcasting, and those on level 1. Can I ask you, anybody that's got phones on, can you ask them to turn them off, please? And before we go on to the agenda items, can I just let you know that on the last full council, those that weren't there, the executive member did make a comment on how much he appreciated the hard work and the effort that this committee puts in. So it's nice to know that we as a committee are recognised and our work is appreciated. So I think it's appropriate to mention that now. So if I can go on to agenda item 1, attendance.
Apologies received from Councillor Graham and Councillor Tomlinson.
Thank you. Anybody else got any apologies? No. Agenda item 2, declarations of interest. Donna?
Thank you, Chair. I've looked at the agenda and the reports, and I'm not aware of any specific interest the members need to declare. I know it's not technically a declaration, but I know that Councillor Mills wanted to mention something. Yes,
throughout the report, the corporate parenting panel is mentioned, and I think it's only appropriate that I point out the fact that I actually, besides chairing this committee, I also chair the corporate parenting panel. If we go on to agenda item 3, minutes of the previous meeting, starts on page 5. If I go for it page by page, page 5, page 6, page 7, page 8, page 9, 10, 11 and 12. Everybody happy that they were an accurate record of the meeting? Yeah. Thank you. Okay. Agenda item 4, action sheet. Helen?
Yes, there's one outstanding item on the action sheet that's been there for a considerable amount of time. What I suggest is the committee requests a verbal update from the officer at the next meeting, and if you're happy with that, I can arrange it for you.
Everybody happy?
Yes.
Thank you. Go on to item agenda 5, which is the main agenda item, which is the safeguarding of children. We've got our first expert witness, which is Dermot McChrystal, Head of Education. Hi, Dermot. Thanks ever so much for coming. I think you know everybody here, so we don't need to introduce ourselves. Just for your information, we actually, before this meeting, a number of us went out and we met a number of young people and we chatted to them. So we're not just scrutinising the report, we've actually done some research beforehand. Can I just ask you an open-ended question? How accurately does the report, action plan and services provided echo the voices of young people?
Well, Chair, obviously I'm not the author of the report, so I'd like to make that point clear at the beginning. I think the action plan as it stands in the report that you've got in front of you mirrors the needs that we've identified collectively as a council. And we always try to engage, obviously, and listen to what young people want. But clearly the area that you're looking at today is quite a complex one, and these are young people who, by the very nature of being looked after, are in some difficulty. So I think it's it's as good a match as we can make it, with the caveat that I know that colleagues in social care and in education and in communities always seek to engage with young people and make sure that once we've written a plan, we've written a policy, whatever it might be, that we continue to actively listen and try to find ways to engage with young people. So it's probably not the best. It can be, but that's part of our... we continue to try and improve those plans even after they're written.
The young people we met, we found it difficult to engage with them. We found it difficult to talk to them. How do you overcome that? Because we found it, they were quite happy to talk generally, but when you ask them direct questions, like one of the questions we asked them is, how do you talk and do you engage with your teacher when you were at school? And they just said, no. And we asked them why not. They just said, don't want to. How do you overcome?
Chair, there's many ways to answer this particular question, and if I could succinctly put this in a 30-second answer, I wouldn't be sat here. I'd be sitting on the top of a big pile of money somewhere else because I've written a really successful book about it. I mean, engaging with any young person can present difficulties, and I'm not going to give the committee a lesson on how to engage with teenagers, but clearly for this group of youngsters, attachment and the ability to form relationships is something that they've all probably either find challenging or being challenged with. And that's a really big aspect of the work that social care and education and their teachers and their carers have to engage in. This is probably the core of the difficulty that many of these young people have. So for me, this is about trying to get stability in these young people's lives in any way that we can, educationally, and obviously in terms of placement and in terms of the care they've got. So for many, not for all, because there are always exceptions, but for many of these young people, asking what should be a straightforward, simple question isn't straightforward and simple, because trust and the ability to really relax with people is quite challenging and quite difficult, which is why this is so complex. And what should be straightforward actually for these youngsters, some of the simple things that we might ask them to do, to stand up and read in class or to engage in a simple conversation, are much, much more difficult than they might be for other young folks at the same age. So for me, it's about being consistent with them, as I said, in placement in terms of relationships, and being patient and accepting that for these youngsters, we need to think about how we scaffold them and support them emotionally, as well as physically and in terms of their learning and so on, in a way that we wouldn't for other young people. And we need to learn to be a little bit more patient. And I go back to my first question, the answer to the first question. We need to continuously look to listen and to be sensitised to how they can communicate with us, because it isn't straightforward.
Somewhere in the report, I'm not sure the actual paragraph, it mentions that attendance at review meetings was poor. How are we going to do to improve that?
Chair, if you could just narrow me in on attendance by whom at the review meetings, just so I'm clear.
Sorry, it's in the action plan. Because I thought, basically, if attendance is poor, obviously we're not doing it right. So what are we going to do to change that? Social care review meetings? Sorry.
This is in terms of the PEP, the personal education plans.
Yeah.
We've also got a dedicated officer within education whose responsibility is for looked after children. So personal education plans, as I won't labour this because I'm sure the committee knows, every single looked after child has got a personal education plan that looks at the individual circumstances for that child and then what supports and what additional support and interventions that child might need. So it's an unusual event for us where we cannot attend. Typically they tend to be for those people who are placed out of county, and it's just physically getting to some of those meetings because some of the placements are quite some distance away, and there may be several meetings on the same day. So it's looking at how we can ensure that we get the best possible coverage, and our aim is always to be at every single one. Where that cannot happen, the officer concerned already links very closely with social care. So if we can't physically be there, there will be a discussion before and afterwards about what's happened, what our view is, what support needs to be. We've got a very close working relationship with social care colleagues, And that officer also attends complex case panels and children and young people panels and children risk panels. So if there was ever an issue for that particular individual, I'm confident, not that I would hope, I'm confident that we'd probably know about that before that meeting. And if there was an issue that arose, we'd deal with that in between. We wouldn't wait for another review meeting. So we'd always aim to be there. If there's an instance where we cannot be, we'll flag that to social care and we'll try and make sure that all those issues are tackled.
Veronica, I think you wanted to ask a question on pastoral care.
Just expand on that. I understand that... No, that's better. Every school has pastoral care members there, and there's a counselling service as well provided. Do you feel we're doing enough with that, or is there more that could be done?
In terms of each school's got its own arrangements in terms of how they want to organise pastoral care. But yeah, all of our schools will have pastoral care arrangements. That's part of the inspection process in terms of looking at the emotional health and well-being of young people. So that's something that's subject to inspection by Eston coming in, and it's something that we talk to schools about regularly in terms of looking at exclusion rates, in terms of managed moves, in terms of other indicators that might give us a window on how effective schools are being. We have obviously just gone out to consultation around support for children with additional needs, and that included looking at the counselling service. And it also included looking at what we need to do around emotional health and well-being in its entirety. So the paper we took to Cabinet recently highlighted that we need to engage in a piece of work over this term looking at the whole spectrum of support for children and young people's emotional well-being, not just looked after children, but all young people. And that will include then looking at what other supports we can put in place. So for looked after children in particular, we have a very close scrutiny on what happens to them in terms of their attendance rates and in terms of their exclusion, but also in terms of their general well-being. But that's now part of we're having this wider discussion as well. And we'll bring back a further report on where we think we should be developing additional support or other types of support with schools by the end of this term, early in the summer. In terms of the counselling service, obviously I think all the feedback we've had, I think literally all the feedback we've had about the counselling service has been very strong and very positive. Again, we always are sensitised and prioritise children who are looked after or who are otherwise vulnerable. And the discussion we'll have with schools is about, in terms of the tender that we now put out, do we expand on the work that we currently have, which reaches into every secondary school and the pupil referral unit, and also provides out of hours service and provides some support to top end of primary as well. So one of the questions I want to ask is, are we targeting that support as well as we might be? Feedback at the moment is that that's actually quite positive and no one's suggesting there's an issue, but I think one of the questions I'm interested in is for children who we know who've got substantial needs, going back to some of the previous answers, like looked after children, should we be making a more specific focus on those pupils? That takes us back to the question you asked in the first place about, well, do I really want this? Because I'm probably seeing lots of professionals anyway. And that's part of the discussion we're having at the moment. And that's something that we constantly think about and look at. Are we tailoring support as best we can?
Now, supplementary to that, reading the report, one of the criticisms made, perhaps more of social services than education, is the lack of evidence. When you're talking about the feedback that you have, is that backed up by evidence?
Sorry, Councillor, feedback in what regard, sorry?
Well, you were saying about the feedback that you have from the counselling services and pastoral care teachers. Is that backed up by hard evidence?
In terms of the impact assessment around the efficacy of the counselling service, there is a specific tool that the counselling service has to complete. So looking at distance travel for the young people who actually get counselling. One of the things, and that's returned as part of the Return to Watch government. But really, I suppose the bigger question that we've opened up is, so the service is good in itself, but is it reaching the right people and in the right way? And I think that's part of the discussion that we need to have at the moment. When the counselling service was funded originally by Watch government, they were quite clear on the model that they wanted. We've expanded that to a wider reach, but what we haven't done is go back out and formally look at questionnaire-based or a guided sort of interview-based sampling of, right, do we think this is good enough? And that's part of what we're looking at the moment. So the feedback I'm talking about is coming directly from schools and head teachers in terms of how they value it. And there was a very strong response in the consultation that we had that the counselling service is very valued. So I think we've more work to do there, and that's part of what we're doing as part of the ALN review and the report that we'll be looking to bring back to Cabinet, as I say, in the summer.
Hi, Dermot. When we went to to meet these young people down in Gumbrae, they said that they were expecting about 14 people there. We ended up with 6 or 7. And they'd done a dietary and food portion presentation to us, and only 1 or 2 out of the 6 or 7 really expanded on the questions that we asked them. Like, is it compulsory for these people to go there, or do they go there voluntarily?
I suspect you probably met about tips, Tom. Not part of my remit, but it's not compulsory. My understanding would be, if they put on a special event for you, having 6 young people turn up, I'd say I'd be pleased with that. I'd be pleased with 50, be more pleased, but I think if you've asked 14 and you've got about a 50% turn up, bearing in mind that must be a very threatening experience for any young people to come and meet a group of professionals and sort of people who are coming in and you don't know who they are. So I think, bearing in mind where these youngsters are in their lives at the moment, that was a very brave thing for them to do. And, I think they need high praise for coming and engaging. And if I'm honest, I'm not surprised that maybe some young folks thought, hang on, maybe there's more interesting things I could be doing.
Chair, I'm not criticising it, and
sure.
I just seem disappointed at the number of people answering the questions, basically, and the number of people that was there.
I think what it clearly was, a number of them wanted to say things. As I said, when we spoke to them outside of the formal arena, they were quite chatty. But when we were sat around chatting, or trying to chat, they didn't want to engage. So it was obviously a confidence issue. And how do you overcome that?
Well, Chair, I go back to my previous answer, but I'd maybe leave you with or give you a thought, maybe just to have a mull over. For lots of these young people, they'll be involved in meetings with adults, professionals, people dressed like us, and those meetings will involve them, and they're talking about the most intimate parts of their life, the things that bring them pain, the things where they know they've sustained damage in their lives, things that they're not happy with, and for many of them, that's their experience. That's how they feel when they go into a group of adults. And even though you might be talking about something completely different, clearly that's the emotional context for them going into that meeting. So I think when we're looking to engage with children and young people, we really have to step outside, what we've prepared to do, and really try and get underneath what's that young person's need. What's the emotional context for them in the way I'm structuring that discussion with them? And what do they get out of it? What's in it for them as well? So it's, what are the challenges and barriers that they're going to face in that context? How do we try and limit or remove them? And also how do we sort of demonstrate to them that's something that they might value? I suppose with my psychologist hat on, doing one-to-one work with children, which is a little while in the past for me, but doing individual work with youngsters, it could take 3 or 4 sessions before you actually get into a meaningful dialogue about the core issues, because quite often the things you want to talk about are the things that are distressing or the young person are actually anxious might be.
Thank you, Chair. One of the things that we've also did, and as was just general feeling that the whole of the committee had, was how do is there maybe young people have ideas on what they'd like to do and where they'd like to get to. But the thing is, how do we show them, well, to get to there, you've got to do this, this, and this, and how do we, are we making progress in showing people how to get to where they want to, how they get to where they want to get to, and all that sort of thing?
I think there are many layers of support, obviously, around all children and young people, and particularly around young people who are looked after. So, obviously, in terms of social care, there'll be the linked social worker's responsibility. For us, it'll be the vulnerable children officer, the looked after children officer's post, who would also meet with those young people to go through that. Clearly, the support at school as well, and from Careers Wales. If you look at our success rate in terms of outcomes for children and young people who are looked after, that's been improving over time. So that most of our young people now coming out, which I think is on page 20 of your report, if you look at the top of that page on 8.8, this isn't the only indicator, but I think it's a useful sort of benchmark to look at. Of the 18 young people who left school as of September 14, then there were only 2 out of that cohort who weren't able, at that point, to really support through college, placement, in this case, sixth form college or work. Now, 2 isn't okay. And as everyone here knows, we've had a particular issue with the numbers of children and young people who are not in employment, education or training. But bearing in mind the needs of this group, I think that's an indication of the distance we have travelled, because obviously in terms of our general needs figure, we've gone from being one of the poorest performers in Wales to one of the best performers in Wales over the last couple of years. And for this particular group, while I'm not saying at all, please don't take this message, that I think that's a good outcome, because it's not just 2 young people out in placement, I think it's symptomatic of the fact that we've got improved layers of support there in place, and we're really able to engage with young people at a point, even in a very difficult, challenging set of circumstances for them, and direct them and support them into those placements. Clearly, some of the work we're now doing, and it might be something that we need to come back and talk to you about further, is looking at our needs figures, not just for kids at 16, but also then at 17, 18 and so on, to see how they continue and how those placements are successful over time. But I think we've always got more to do, but I think young people now have a range of information available. They do know the options. The issue for us is about making sure information is only one part of the equation, clearly. It's about, are you emotionally able, are you intellectually and scholastically, in terms of what your skills are you able to engage with those opportunities? And again, I think there's evidence just in that small sort of table there that we're improving in that regard, but we'll always have more to do. I'll never be happy until we've no needs.
I think that's one of the things which I think has been put out in certain parts of the report, that sometimes that the feeling that the being with the young people and seeing the young people can too often be considered an end in itself. We have the meeting with the young people, tick the box. But the thing is, then what? What's the result of it? I think that's I think that's a concern of a lot. I think that's a concern that we had. I said they always say, "Okay, you've done that, but what have we actually got from that work that's being done?"
I think for me, the answer to that has to be about how prepared that young person is to be successful in their independent adult life, and what contribution they can make, as well as, being blunt, ideally we'd have a happiness measure, and we would look at actually, what does that mean? For me, that would be about ability to form and maintain relationships, as well as then these other things that we look at in terms of how many GCSEs you've got, are you in a college placement and so on. So I think there's a lot of work ongoing to try to ensure that young people, we're not just mechanistic in our approach and that we've processed a piece of paper or that you're a statistic. I think, one of the key things, and this is why I started my contribution, is that I think the vast majority of professionals I work with in health, social care and in education are committed to helping those young people not only make meaningful choices, but have the social skills and the emotional wherewithal to be able to make informed choices, not just do the right thing because that's what you're supposed to do. So how you measure that is quite difficult. So often we're looking at markers of success that imply that you must have that emotional repertoire, that you've actually overcome some of those difficulties that you've had. But I think we're really clear in Torvine that the teams around children, and that's multi-agency teams, are there not just to get them in placement and get a piece of paper off. It is to try to make sure that those young people are as robust and resilient as they can be in all domains. Measuring that's always a little bit trickier.
Shall I go on to... I think you've partly covered this with what you've said, but just to sort of pull it together, again using an open-ended question. How does the relationship between the Education Service and the Children's Service improve the educational attainment of looked after children?
For me, I mean, one of the things that characterises my work in Torvine, I've worked, I suppose, in 3 other authorities, as well as Torvine, so a couple in England and another one in Wales, is the clear understanding that these are our children. So there were always going to be issues around budget and around budget and actually who pays for what bit and so on. Now we've years ago, I think it's gone back nearly 20 years, worked out a protocol with social care. So when we're looking at out-of-county placements, for example, there's a very clear process in place. There's very clear funding arrangements. We would love to be able to say that we had cracked that with health and continuing healthcare. We haven't quite got there yet. We're not there at all, in fact, with health. But between social care and education, we have already gone well beyond the sort of what's the process around this and how do we communicate. We have very close systems where staff work very, very fluidly together. And I think it comes from the fact that we just see these as our children. So in terms of how do we transport looked after children, we have a protocol around that, how we fund, protocol around that, how we plan out-of-county placements, very clearly articulated and well-worn practices that I think are really successful, which enable us to be quite responsive. So we don't wait for something to happen. If we know that there's an issue, people just pick up the phone, say, well, we've got a problem, how do we solve it? We don't wait for 2 weeks for another meeting to come about. And for me, those are just symptomatic little signals of how we have this joint ownership of our children, and that's how people talk about it. So for me, I've never seen a closer working relationship between social care and education. Bear in mind, our last post before I was here was in Bristol, albeit at the start of Every Child Matters, where children's services were social care, education and health coming together. And I think we've got a much stronger, closer relationship here than I've witnessed in many other authorities elsewhere.
You've talked about the 2 services. What about the difficult one, CAMS? Are you happy that that's developing and becoming closer, particularly now that it's extended beyond 16 in terms of the education up to 18, or 25, in fact, with young people? So do you feel that that's starting to have an impact?
In terms of CAMS and health in general, I mean, I would, if I can be so bold, would wisely to say that for me, continuing healthcare has been a perennial issue for us as a council for 20 years. And at the moment, I'm not aware of any, Ruth will correct me on this because I'm a little bit removed from the direct detail of it, but I don't believe we've got any tripartite funded young person in Torvine at the moment where health, social care and education are funding. That for me causes some significant concern because I'm aware of many cases where I don't understand why that's not the case. So I think that there is a piece of work that we're looking at with health and social care colleagues to see if we can get some engagement around that, but I think that's an ongoing issue for everyone involved, both at a political and an officer level. In terms of CAMS particularly, there is again another piece of work looking at how we can ensure that the children who really need support from CAMS get that support. There's clearly excessive demand in this. Excessive is the wrong word. There's a substantial demand in the system to health for additional support for CAMS. I would say that some of that is absolutely valid and some of it isn't. And one of the things that we need to do is to make sure that, going back a few years ago, there was a document, Everybody's Business, and looked at actually what's the responsibility of teachers, of parents, of social workers, and so on, to look at how we support emotional well-being for everyone. And I think one of the things we need to be mindful of is that mental health and emotional well-being isn't just the responsibility of one team or one organisation, such as CAMHS. It's actually written in all of our different documents and requirements on us. So I'm really conscious that one of the things we want to do with education staff is to remind them of their responsibilities, which I know they're very mindful of, but being clear what that looks like. Look at the range of support that they need to be able to deliver that, and get that training and other systems in place, so that we're only making referrals that really need to go then to those specialist services. And I think social care are looking at that too. So there is a joint piece of work going on with health and social care and education with CAMHS to see if we can do that. The reality is, though, there still isn't enough CAMHS. So even though we get that right, so we're only referring the children who need to, I'm very clear from the briefings I've had with health that there isn't, at the moment, sufficient resource within CAMHS to actually meet all of the demand. So that clearly puts pressure then back on other, on other services, which we are trying to meet. I don't have an answer to that. That's obviously something that colleagues in the NHS and government will need to resolve as well. But what we are doing is trying to make sure that we get the best value from the CAMHS that is available, and I know that's something that CAMHS are keen to work on us with, and we are engaged in that process at the moment.
Dermot, you said that you were happy that education and social services were working close together. But where's the evidence of this? Because, I can't find any evidence of this. So have you got any real concrete evidence on this?
My temptation is to throw that question back and say, well, where's the evidence that we're not? But I wouldn't do that, so I'll see if I can give you the evidence of that. In terms of the structures that we have in place and the requirements on us to actually formally meet, I think whether that's appropriate, that's something that you can ask with. Clearly the minutes of all those different meetings exist. So in terms of how we jointly plan for pupils who go out of county, how we jointly plan for pupils who aren't at the point of needing a specialist placement, but we want to intercept and trying to avoid. We have a complex, so we have a vulnerable children's panel. So we have a series of structures that are clearly minuted, that are clearly resourced, and people attend to look to see how we can divert children from coming into some of these, into the system, or who then are in the system, to avoid them going out of county. So I think in terms of our compliance with the requirements on us, that's there and evidenced. In terms of how we work with social care, in terms of other, I'm just trying to think what sort of evidence you're looking for, Councillor Taylor, in that regard. I'm confident that that's happening. I'd have to sort of have a think about what, or you need to tell me what particular evidence you think that you need to see to make sure it's happening. The issue for me, clearly, from education's viewpoint, is I'm confident we know every single looked after child. I'm confident we've got a personal education plan in place. I'm confident that we work with social care on each of those. I'm clear that we've put the resources in that we need to do, and trying to put additional resource in for those young people, that we challenge schools to make sure that they're using their grants appropriately, and we involve social care in those discussions. And that's evidenced through, as I say, either through individual meetings, through the personal education plan, and clearly evidenced through the outcomes that we get, in terms of where those young people go on and the range of qualifications they get, and I would say the stability of those placements. Now, none of those measures, certainly stability of placement, is something that we can guarantee that no matter how good our working relationship is, will guarantee that stability of that placement, for instance, because clearly, given the nature of the population we're talking about, things can happen where the young person doesn't want that placement to be stable, for instance, or that placement just can't continue. So I think there's a range of evidence. I suppose it would be helpful maybe to have a discussion about, well, what would that look like for you to give you that reassurance, and we can pull that together between ourselves and social care.
Can I come in there? If you have a look at paragraph 8, education attainment for year 11, looked after children. If you look at paragraph 8.4, it says the average point score for the 16 pupils was 298.7. Now, that statement in itself means absolutely nothing to us. What does that compare with to non-looked after children?
Chair, again, I have to confess I didn't write it, so, you know, Chair, we can bring, and I haven't got it with me, but we can give you the Torvine average, and that's what you need to compare it with, and we can do that with the Wales average as well. What we won't have, I don't think, but we can check, and this is what the looked after averages as well, but I'm not sure that's published, but we'll need to check on that. But we can certainly give you the Torvine, probably the South East Wales, and the Wales average, I would imagine, as well, so we can bring that to you.
So, I think it's on 12.9 we've got
Page 22.
page 22. We've got some of the Wales average. For Wales average of looked after children. Got some of that. I see we got that there. Yeah, I think one thing we are concerned is being better than the Welsh average good enough?
Well, it's a good starting point. You're right, though. I mean, our aspiration can't be mediocre and average. That's not what we're aiming for. Clearly, where we are at the moment in terms of, to me, that figure's a bit meaningless, really, because you've no idea what the context for those individual learners is, and just because they're looked after, that may not. I don't think that's a good enough summation of you as a human being. There's other things going on. So is that a good enough comparison tool? So, but as a starting point, it's at least a little reassuring. But if everyone's performance is really low, and that's massively off where children who aren't looked after are, then clearly it may not be the best measure. What we really should always be aspiring to, at least as a starting point, is that this is the performance of looked after children is comparable with non-looked after children. I mean, that's clearly where we should start from. So that's the information I think you always need contextually as well. So, didn't realise you've got that information, but I think, yeah, I can certainly happily work with Ruth and with social care colleagues to look at trying to give you a more informed view, rounded view then of performance across Year 11, and do that on a Torvine regional and national level. Notwithstanding that this is the way that it's reported to Welsh Government, so there may not be all the data sets in terms of comparability that we'd like to have, but we can certainly have that discussion.
Does anybody else have anything they wish to ask Dermot before I allow him to escape? I think we've covered everything. Dermot, can I just say thank you so much for coming, and thank you for giving us very comprehensive and extensive answers to our questions. Thank you. The next lady will be coming in will be from the CSSIW, Mrs. Anne Ferris. Hi, good morning, and thanks ever so much. You're Anne Ferris. Are you quite happy for us to call you Anne?
Absolutely.
That's right. Thanks. My name is Councillor Raymond Mills, and I chair this committee. We understand that you're not going to talk about Torvine explicitly, but can you tell us, as an opening question, should we say, what arrangements are in place to judge the suitability, robustness and effectiveness of the post-action plan and progress made across Wales?
Right. Okay. Lovely. Thank you. Thank you. Yes, I think there has been some confusion about actually my role and in relation to the safeguarding inspection. Would it be useful if I did a little bit of background about where it fits in? Is that okay? Right. My role is as area manager within Care and Social Service Inspectorate. So I have lead responsibility for Torvine Social Services, both adult and children, and also Monmouthshire. the strategy team, we have a national team within CSSIW, and they are the people who actually conduct the national inspections. So would have undertaken and led the inspection in relation to looked after children and that safeguarding inspection that took place in May of this year. I was a part of that team that actually came and undertook the inspection from the perspective of being the area manager and having more of a local knowledge and a detailed knowledge of the issues and the circumstances and the culture of Torvine in relation to children's services in this particular instance. And although the national team look at things on obviously a national and a strategic basis, and their inspections, the looked after children inspection, would have looked at particular issues across all the 22 local authorities, would have looked at themes, would have looked at patterns, and then would have come back and would have made some assumptions on a national basis about those. We've got a national report that's coming out, I think, tomorrow that will look at that across Wales. So that's their remit. That informs things like ministers' policy, any changes that there are, any, for instance, where there are pertinent issues or challenges that are around. For instance, the looked after children the levels have increased. Nationally, we will be wanting to know why that is, what the issues are behind that. So that's the national part. My part then in relation to the area manager role would be to look, this inspection report that was undertaken would feed into the annual council reporting framework that I am responsible for, that I present to council on an annual basis. And any recommendations that have come up, or that have been any issues that have been picked up, we would pick those as part of the monitoring that we do with the Local Authority of Social Service Department. That monitoring, I meet with the senior management team, myself and my regional director meet with the senior management team and social services on a 3-monthly basis. I also meet with the heads of service, both children and adults, on a 3-monthly basis as well. And at those meetings, we always have on the agenda, we would always have the areas for improvement. We would always look at progress that the authority is making in whatever areas that is. And we would monitor it in that way. The other way that I would be looking to monitor would be looking at evidence from other areas. For instance, the performance indicators, the statutory performance indicators that the local authority provides for Welsh Government. I would look at those on a 3-monthly basis. They're sent to me by the head of service. And I would be able to look at any outliers that there is in that information. It's not, that data isn't verified, but you can get a sense of where there are huge differences maybe between one quarter and another. And I think because one of the, I suppose, good things really, because Torvine is fairly compact, and the numbers, although they may not seem to you to be low, but in comparison to some other local authorities, they're small in terms of numbers. So you can see any outliers very easily. You can see if a large family, for instance, has come into the local authority and children have been taken to, so you can see those changes very rapidly. So it's picked up that's one of the ways, in fact, we pick it up.
Can I ask you, when you go into a local authority to do the inspection, what sort of percentage sample size do you look at? Is there a set formula, or do you just say, right, you've got 300 looked after children, so we're going to look at 10 or 20?
Do you know there isn't? Because I knew one of the questions was going to be around how the national team had actually come up with their sample. We don't look at a particular percentage. What we tend to do is, as an example, if we're looking at looked after children, what I would want to be looking at would be not necessarily numbers. I would want to look at children who had been in the system for a period of 3 months or 6 months or whatever. I would want to look at a selection of children across a number of age groups. I might want to look at, depending on what the angle of the inspection was, I might want to look at a particular area in the local authority that may have been picked up or maybe the senior management team might have said, you know, we're quite concerned about Area A in Torvine because we seem to have a lot of children who are coming into care in that particular area. In those instances, some of the work that we might decide to do might be, alongside the local authorities, to look at that particular issue. So it's really horses for courses in relation to that. We don't necessarily go on percentages. What we would want to do, however, is we would want to have a representative sample that would be large enough to be able to give us a fairly good basis for making some sort of judgments about you know, the outcomes for children, whatever it might be.
Thank you. I'll ask one more question, then I'll open it up. What sort of preparation would you expect a local authority to make before you come in? Do you say on a Friday, right, we're coming in on Monday, or do you give them days, weeks notice? And what do you expect when you get there?
Right, if we're when I do my annual report back to council, I would look, as part of that, one of the key things I would be looking at is obviously the statutory report that the Director of Social Services presents. And in that, the Director would be saying about areas where improvements have been made, and is very, I mean, Torvine, like all other authorities that I deal with, is very honest in saying, and the challenges for us are these particular areas. And normally we would work together. We would work very much in partnership, I would think, and Torvine is very, very good at doing that. I feel I've got a very good relationship with Torvine in identifying what the issues are, and then saying, well, actually, we might need to do a bit of, you know, further digging on this or further looking at this particular aspect. So we would generally tend to agree those together, and that would be in advance. So we would decide at the beginning of the year, if you look at my last report which looked at last year, 13-14, sorry. We would have identified the areas that we're going to look at the beginning of the year. And if we're doing a national inspection, for instance, we would say to local authorities, you might get 2 months, maybe 3 months notice. You would certainly we always give at least 6 weeks notice of the actual date that we're coming in. We would, our support team would have been in touch with your support teams who support your senior managers in saying, these are the policies that we want. We want to look at a sample of this number of files. We would want you to give us this performance information in relation to a particular time of year, whatever. Then we would look at we would look at the numbers, and then we would pick a sample from that. So we would say to the local authority, yes, we want to look at 10 cases, and we want to look at those in relation to children who are between 0 to 4, children who are school age, care leavers. And we would expect when we come that information would be there available to us on the day. We would expect, and have always found when we come to Torvine, preparation has been extremely good. Senior managers and all staff are very well prepared for us coming. All staff are very much aware that we're coming and what we're coming to inspect. Sometimes you might go to a local authority where social workers you're interviewing and they're not awfully clear about what the inspection is about. I would have to say I have not found that in Torvine. Senior managers are always extremely available. Often when we come, when we're maybe looking at a particular file, and we always have access to either paper files or your electronic files, often when we look at some information, then we need further clarity or we need additional information in order to give us a better perspective or a better understanding of why a particular decision has been made. That has always been forthcoming. I think one of the other issues for me in Torvine is because it's small and the number of senior managers have a big portfolio. Often you can get the answers to 2 or 3 questions from the same person. It's probably very difficult for them, but yeah, I mean, head of service particularly is always around. The Chief Officer, Sue Evans, has always been available and around on a daily basis. So yes, they're very evident. They're very much in evidence when we're here. I mean, again, sometimes when we go to inspect in local authorities, sometimes managers kind of keep out of our way. It's much easier, from my perspective as an inspector, it's much easier coming into a local authority where I can pop next door to somebody and sort of say, you know, Ruth, what's that about? Yeah. You know, rather than go through a very formal process of, you know, it works. It works well. It works well.
Yes. You go into all our local authorities and all, but then your reports, how long do you take for you publish your reports, and how long before any actions that you have recommended would you expect an authority to implement it?
I would have to hold my hands up, although I probably wouldn't want to admit it. I'm only joking. CSSIW aren't always the best at producing reports in the most timely way, and maybe one of the reasons for that is because we're doing some stuff on a national basis. At the end of any inspection, and if we use, for instance, the safeguarding inspection that we undertook, that was, I think, it was a 4-day fieldwork inspection when we were actually here. And on the last day, feedback was given to the senior management team about the key high-level points that there were, about the areas for development and areas of progress. And I mean, certainly in relation to this, and you will obviously have read it, there were significantly more areas where progress had been made than there were improvements. It was you know, it was a good report. But we would give feedback to the senior management team at that stage, at the very end of the inspection. We would give verbal feedback at that stage. The caveat, obviously, on that day would be, this is what we found to date. We still have some analysis to do in relation to maybe performance indicators, additional information we might be having from Wales Audit Office or Eston or whatever it might be. We would expect, and Torvine have, they would immediately be looking at an action plan, to put an action plan in place. And certainly at our first engagement meeting following the inspection report, that would be available, and work would have been done on that already. It will be in situ.
Thank you, Chair. A supplementary question on this. Are you aware of the National Thematic Overview Report?
The Thematic Overview Report hasn't yet been published. It is due to be published, I think it might even be today. Sorry. I think that the Thematic Review the Overview Report is due to be published actually today. I think it's going on. Is today the 29th? The National... Tomorrow. Yeah. Sorry, were you asking, was I aware of what was in it?
No. Oh, wait. We are aware that we are aware that there is a report,
yeah.
But you know we can't seem to find anything about it. So this is why I was saying to you, how long do you take doing your reports and putting it back to the local authorities? And again, where is there any evidence of all of this?
The report is being published on the 29th, and if that did you say was that was tomorrow? That will be on our website tomorrow. I guess the issue it's the local report you would have had. Your report you would have had in July, I think. I understand it was July. Yeah, and we had undertaken that inspection in April, May. So you would have had that within the 3-month period. The national report obviously has to wait until all of those inspections in the 22 local authorities have been completed, and they would have been completed over a period of probably about 6 months. I think it was, Sarah, wasn't it? The first 6 months of the year. So those themes and those national themes then need to be drawn together. So that's obviously what takes longer for a national report to be published. I understand, although I stand corrected, that it was the intention that report was always going to be the national one was always going to be published in January. And as I say, it will be on our website the day after tomorrow.
Thank you. Does anybody ask any other questions they would like to ask of Anne while she's here? Nigel?
One of the, being members of the council, of course, the thing is that everyone wants to know what's happening and the feedback to us so that we are, because ultimately it's ultimately we are responsible. And in your experience, how good are we at getting, and how good are authorities at getting the information back to members, more to the point, correct the correct information that they can act on, because one of the and also that sometimes there have been problems about in certain areas about the quality of information that has been brought back, saying one says is the one group of information which might be internal, would based on certain internal things turn out not to be the case when they measured it or when externally measured. That's something that which I think we're all very concerned about. Is how is in your experience are members getting good enough information for them to make the right judgments and the right decisions?
That's a big, isn't it? I mean, again, I can only speak for Torvine. In relation to, for example, corporate parenting, I mean, I think that that members in Torvine, you have a corporate parenting strategy. It's certainly one of it was one of the examples of really positive practice that came out of your the latest inspection, and I think that that a lot of work that goes on with members and a lot of the learning, I think it's just really important to have learning and to have learning opportunities and to have that one-to-one dialogue with heads of service, and I think that happens frequently in Torvine. I understand that there was something like 3 or 4 sessions with corporate parenting members over the last 12 months. That doesn't happen. I would have to say that doesn't happen in every local authority that I've worked in. And I think, I suppose, my experience has been that that I have not found, when I have been speaking to members and I've presented to members in Torvine, presented back on the reporting framework, I've not found, and I've not been given to understand that they don't understand what I'm talking about, or anything that I'm saying is a surprise. So if that's one way of actually measuring about how accurate the information is that members are having from officers and having from ourselves externally, I would say that it's positive. I'm trying to think, when I was at the inspection, did I interview members in Torvine in June? I don't think I did, but certainly I would have heard back if there had been any anomalies in terms of members' understanding about what the situation was in relation to looked after children in Torvine and the challenges that there were, and what the reality was. I don't think that we found that there were any anomalies in that which would suggest to me that members are being appropriately informed. I think there's ongoing development and there's ongoing learning, and I think that that managers, senior managers and the council are very aware of the need for that, and that does happen. So from my perspective, I would say in Torvine it's positive.
Given what you've just said and your response just now about the fact that the report, the national report, is being published tomorrow, do you feel that we as a scrutiny group would have been better to wait until that had been published, or do you feel that the work and the trust that is ongoing in Torvine between members and the staff is sufficient for us to come up with an appropriate response?
I think you probably would have missed a trick if you had waited. until the national report was published, because that would have been a period of time when maybe work may have been slower in terms of the ongoing improvements and the developments that are taking place. I've had a look at the report that was produced by Sue and by Ruth, the information that I had for today. No, I think it was wise to kind of get the ball rolling fairly quickly. I think as well, from my perspective, Torvine is at, although it's certainly got its challenges, Torvine, one of the really positive things is you've got a very stable senior management team. You've got a very good management team. The one thing I think that I found when I came was, and I do find in speaking to staff, is staff are very committed, they're very enthusiastic at all levels, and I think there's a really good, robust relationship between managers, members and staff on the ground in Torvine. I would say that's one of the positives about Torvine, one of the many positives about Torvine.
Anybody got any other questions? Can I just say, Anne, thanks so much for coming. You've given us a huge amount of information that a lot of it we didn't know beforehand. And can I also thank you for the very complimentary things you've said about Torvine. We don't hear that very often.
Well, I suppose that's always the problem, isn't it? You don't have the opportunity maybe to... Yeah. You're very welcome. You're very welcome. Thank you for inviting me.
Morning, Ruth. Thanks ever so much. I don't need to, you know everybody. You've been here many times before. Thanks, Ruth. Just to reiterate what I've said on many occasions before when you come, we've all read the report. We've read it. And I'm sure you know that we actually, as a committee, went out and we met and we talked with a number of young people to get their viewpoints. So is there anything you want to update us on before we...
Well, only to say that the national report has come out last night, embargoed until later this morning. Yeah. So I can't actually tell you anything about it, but imminently the national perspective, which is, I'm very keen to read it. So,
Ruth, how can you evidence the suitability, robustness and effectiveness of the post-inspection action plan and monitoring arrangements?
Well, obviously, it's something that I personally look at on a regular basis, myself, to see what progress we're making, because it's part of my own work plan, if you like, because it's such a sort of core and key document for the divisional performance and responses to the demands. But in a formal setting, we look at it at DMG, and obviously DMG is our divisional management group, and that's what it's a minuted meeting. So obviously that's evidence for sort of future inspections, for example, something that I might share with the inspector on one of our sort of regular sort of linked meetings, and then to take it sort of to senior management team on a sort of twice yearly basis, really, to just check, that they're satisfied that things are progressing.
When I read the report, one bit that really concerned me was on page 18, paragraph 7.2 and 7.4, sorry, when you say the preparation for any inspection is considerable and this is no longer resourced, and you say the physical and practical arrangements to manage are a problem. Can you explain why they are?
Well, in days gone by, we used to have people that would sort of do all the sort of coordination. Because what you've got to remember is that we're looking across lots of different teams, lots of different individuals, lots of different cases. We don't exactly know what the inspectors will want to look at until they've decided. So we have to sort of prepare everything ready. Then they make their sort of selections. And then we have to coordinate with the inspection team's diaries to get the people to where they need to be at the right time, and it is quite a complicated business. When you look at it, you know, the sort of period is a matter of days, but to actually get to the point takes an awful lot of work of people sort of coordinating, say, yes, can you do this? Can you be there? People might have to change what they were doing in order to fit in with the dates, etc. So that is quite resource intensive. The other thing that we've noticed since we're no longer in a large sort of facility like County Hall, we haven't got the rooms available, and we used to be able to give over rooms to the inspection team, so they weren't, you know, we weren't having to move people out, and you know, and that's not, you know, that is not the same anymore. Obviously, we're on a much sort of tighter accommodation arrangement now, but mainly it's the sort of it puts on our performance and development team, because they've got to sort of, you know, ensure that all the data and files are, you know, in place for the inspection team at the right time. So I'm not moaning about it, or sort of, you know, I'm making the point that in days gone by, we had teams of people who just did that. And then from an operational perspective, we would just arrive on the day, the inspectors would arrive on the day, and someone else would have dealt with all the arrangements. Now we do that ourselves. Does that make sense? You know, more so, yeah.
Are you happy, and I know I'm dual hat because I'm the corporate parent team chair, are you happy with the accountability to members?
Do you mean in terms of the sort of the general corporate parent and etc.? I think we've really moved forward. I mean, it has been a journey, and it continues to be a journey, because obviously it's not something that overnight everybody sort of understands, and it is at the same level of what the corporate parenting responsibility is. But I think we've moved forward. We've had several member seminars. We've had good discussions at corporate parenting panel. You know, I hope that you would agree with that. I think issues there have been sort of discussed that previously didn't have anywhere to be discussed. You know, and would only have come up in the sort of member arena if something had, you know, come up through a scrutiny report, for example. So I think now we've got a much wider, almost a multifaceted approach to sort of involving members in the core business of children and family services.
Veronica, do you want to go on to your question, please?
Shall I go on to my question? Thank you. Thank you, Ruth. I'm looking at the educational attainment aspects. How do you feel the relationship between the education service and children's services improves the educational attainment of looked after children?
I think the biggest thing is that if we've got a good relationship, if we've got good communication between the two sort of departments or service areas, then we know the children. So if we both know the children, then we're both going to understand the needs and hopefully have a better care plan or education plan in place. So that would be my view.
Right. So you do, thinking of that, do you feel when you look at the average point score for looked after children, which is approximately half that of all children, do you feel that that is showing that, or is there something that needs to be looked at underneath that to try and pull it up?
I don't think it's good enough. I don't think the educational attainment of looked after children is good enough. Of course I don't. You know, I think that we have to have high aspirations, and we need to be comparing with children who aren't looked after. But I think what we have to remember, and I know I've said this in other sort of contexts, is that children that have been, you know, for whatever reason, you know, they're not living at home with their family, or, you know, they may have come in through quite a traumatic experience. They may have come into care because they haven't indeed been attending school. Actually, getting the attendance, you know, at school is the first step. And some of them, for some of those children, it's actually too late for them to attain within the normal sort of timeline of non-looked after children. And it may be that later on, which is why the leaving care arrangements are so important, that we can support them, you know, as they mature into adults, because they may not have had that opportunity, or their opportunity during their school lifetime has had, you know, a serious sort of provocation to derail it, you know, to take it so that it's not the sort of, you know, working along it, their peers in the same way. I think we have to aspire to do better. I think our relationship with education is as good as it can be while we're in separate service areas. You know, we do communicate. You know, I know, I'm confident that I can get information quickly about particular children from an education perspective, so that we've, you know, got that sort of relationship. But it's very difficult to take away from a sort of child's whole life the sort of emotional trauma that they may have, you know, suffered, that is going to impact on how they attain educationally.
Yeah, do you feel that the packages of support that are put in place are adequate, or do you feel that there needs to be much more? And is it a financial consideration, or is it much more about emotional support and how that's provided?
I do feel confident, by and large, that most of the children who need to have, you know, extra help or support do get it. I have, since my last attendance at scrutiny, one of the things that I did do was go away and look at the sort of grant for looked after children, which is now held by schools. And I contacted the head of education to ask, you know, how was that being spent? And obviously he hasn't got that overall perspective because it's now with schools. So it becomes quite an individual way of finding out exactly what's happening. We've got some sort of information from some schools, but not from all. So that's something we're actually doing at this very moment, because we've got 2 children who do require laptops, and we were looking to use that grant. You know, that we feel that grant is would be a good use. So we're in discussions with the individual head teacher on that school. But in terms of sort of, does a child need support in the school setting? You know, we've got some good mechanisms in place, you know, in partnership with the schools and with education. So.
Ruth, I'm looking at this children and families page here. On page 1, analysis of needs of the children with risks and challenging behaviours has been presented in a paper to SMT and will be incorporated into the works of multi-agency children region strategic partnership board chaired by the chief officer. Has this been completed?
The work is ongoing. There's a subgroup of that board, of that partnership board, which is made up of a multi-agency group, and they've what's going to happen has been identified, and now currently in a position to sort of put in place what needs to sort of move forward. So it's not something, when you're working with lots of partners, that can just be done overnight. It does take time. We were due to have a presentation on the sort of story so far in December, but unfortunately it was actually a consultant psychiatrist that was going to present. He couldn't be there at short notice, as neither could I. So I was pleased, actually, because I haven't missed it now, and that's been sort of brought forward, and it'll be at the next meeting. So I'd be able to update members following that meeting.
But Ruth, shouldn't there be a time limit on these things? Because, you know, these are the needs of our children. It shouldn't be ongoing and ongoing. We should have strict boundaries and time limits for these things to be in place, because at the end of the day, the children are our greatest assets. The other thing on this, at the bottom, demand management workshops held in 1909-08-14, facilitated by PwC consultancy arrangements and project managed by the corporate centres. Ongoing work results in an analysis report. Who attended these workshops? When will the report be finished? Who is the project manager on it all?
Okay, I can answer those questions. Well, I can't list everybody, but the workshops were well attended, particularly as one of them was in August, and I feared the worst. I thought, well, no one will come, from the multi-agency, but actually they were very well attended. And the work has progressed it's moved into the sort of identification of themes, and then of lead officers being appointed for each theme. And one of the things that I'm particularly pleased about is that what we've been able to do is dovetail with the sort of strategy for early help and prevention, so that we're not going to be duplicating and we're not going to be going off on different tangents, that we're actually bringing together the two strands, looking at the demand for children's work and services, and also the need to help families earlier on so that they don't require statutory intervention later on. So at this moment in time, as it happens, I'll be speaking to the lead officer, who is, should I say his name, Mark Sharwood? Yeah, Mark Sharwood is the lead officer for that work. I know that there was a workshop that nobody from social care actually attended just, this recent, since Christmas, because it was organised at too short notice, unfortunately. And bearing in mind that we had worked over Christmas, so people were taking leave in the early January. So it was just one of those things. But we're very engaged with the process. So.
And my final question, Ruth. Where is the evidence of all of this that we could see?
I would imagine Mark's got quite a big file. I've got plenty of stuff myself, in fact, because PricewaterhouseCoopers, who are the sort of the outside body that the corporate centre has brought in, they've done a lot of scoping work, a large amount of scoping work. I know things that sort of like the behind the scenes work, looking at the financial profiling, and not just in social care but across the whole of the council.
I think that actually leads us nicely onto Nigel's question.
Ask a general question. You talk about multi-agency. What is the relationship between the agencies, all the different agencies who are part of the game? What is the relationship?
Well, yes, that's a good question, actually, Councillor. That is a good question, because what constitutes a relationship? I suppose when we think of it on a professional capacity, it's about, do we know who to contact? Can we contact them? Do they come back to us? To me, those are the sort of professional relationships that we would sort of seek to at least have. And some of those relationships will be more developed than others. Where there's a long-standing relationship, i.e. there hasn't been a reorganisation in one of the agencies, which does tend to happen, and we know who everybody is, and that's usually when things are mature, well-established, and they're the most effective relationships. So I can't say that there are any relationships that we've got that are not relatively mature, some more than others, because the people have been in post for longer, so we know people better. We know how we've got a good understanding of how their agency or organisation works. That works well. So equally, we're bound to have a better relationship with our education colleagues within the council, because we've got a better understanding of how they operate than we would with, for example, with the Health Board, which is a much bigger and more complicated organisation, which in itself has got lots of different sections, departments, divisions within it. So we can never assume that one talks to the other. We always have to make sure that we communicate with everybody within that sphere, because it may be that they're managed by different people. Generally, they would be. I can give you a good example of that, actually. A recent meeting, and I'd made the assumption that the senior nurse present worked within the same division as the psychiatrist present, but in fact they didn't. And they were also learning, as I was, about how each functioned. So it's complicated, it is.
Talking about multi-agency, thinking of these children who very often move boundaries from one local authority to another, quite frequently during their lifetimes. How do you find you manage with keeping track of that and linking in with what's gone before? I've seen some of these histories from a different perspective, as you know, Ruth, and I'm quite concerned sometimes when I see just how much disruption these children who go on to become young adults have had.
Yes, the only thing that I can say to you there is that when the child comes into Torvine, I don't really like to waste time looking at who's going to take responsibility, because the child has to come first, the needs of the child have to come first, and we would make a decision. Somebody has to get a grip on the case and moving forward, and not sort of waste time in deciding whose responsibility it is. Because ultimately, if the risks are there and they're present and they're in your borough at that time, then there would be no viable reason why you wouldn't deal with it. So we would deal with it. But you would see the histories through, adoption panel, for example, of how often cases that have been in other local authorities, or maybe more than one other local authority, have perhaps drifted or moved about. I can't sort of comment on those authorities. I can only say that we would want to, take responsibility while it's on our patch.
Right on that, about things like, for example, if you're moving from one authority to another, what's your experience of the information that you need to when a child comes into this and has problems? Are you able to access information from another authority and from other agencies that might be linked to that authority? How easy is that?
I'd never say it was easy. But there are processes and there are protocols, and we would generally get the information. Yes, if there is as long as you're working within a sort of clear set of parameters, for example, child protection. People would have their records, other agencies would have their records, and they would have to share them with us, which they would. They wouldn't try and hold that back. I mean, I'm not saying that it would never be that if we said, you need to be doing something with this case, they're only temporarily here, that someone would say, oh no, they've now moved to Torvine and it's over to you. I'm not saying that, that never happens. Of course it does. But what I'm saying is that generally speaking, if we request information about a case that was held elsewhere for that period of time, they would share that information, yes.
No, if I do 3 and then we'll come on to 4. Ruth, I want to ask you a question on the voice of children and young people. How accurately does the report, action plan and services provided echo the voices of children and young people? One of the things I looked at on paragraph 12.4, it says keeping the wishes and feelings of the children as a core issue, which I can understand. But if I remember back when I was a teenager, I actually knew everything, because I did, and teenagers are like that. How do we get the balance of wanting to keep to the aspirations and wishes of the child, but when we need to steer them and perhaps in a different direction, whereas, fortunately, my parents did that for me, but how do we as corporate parents carry out that role?
Yeah, there are times when there is a complete sort of difference of opinion between what the young person wants excuse me, and what we would see as being in the best interests of that child. Giving the child the opportunity to be heard, I think, is the key thing, that they've got someone that they can talk to about how they actually feel, that they can voice their opinions when they sort of say, I don't want to go there, I really don't want that. We have to listen, but we also have to sometimes guide, and equally have to sometimes make decisions that they really don't want. But what we find, particularly with the older element, which the children that the inspection focused on, they were aged over 11, is that you've got more opportunity to actually negotiate and talk to them about, okay, you know, well, what about this? And, you know, have that sort of relationship. Having other opportunities, like for NIAS, for example, to be involved, so they're talking to somebody who's not part of their care planning process, you know, that also gives them an opportunity. I mean, we do, the IRO equally, you know, can talk to the child. Lots of children, we can't force them. I did say that either in the report or the action plan. We can't force them to talk to anybody. We can only offer them and give them opportunity. And there's a situation currently at the moment where a young person is saying she does not want to go to that foster placement. So we're now looking at how we can, you know, if we need to look at something else, then we will need to do that. Because when you've got a child who is almost 16, who you know is going to put themselves at risk if you go directly against what they want, we've got to try and work with that more positively, and to try and sort of meet her halfway, or for her to sort of understand where we're coming from. And that sort of work is going on at the moment. And alongside that, then, we'd have an effective risk management plan, so that if the child does directly go against what we're sort of saying is the plan, you know, that we've got some sort of understanding and safeguards in place.
Right, Ruth. Going back to this Children and Family Service Inspection report, page 4, please. There is a capacity issue for social workers who have caseloads of above recommended levels. Could you tell me what the recommended levels are?
The recommended levels can be anything from 12 to 18, but I like to think they're sort of 15 to 18. That would be, my aspiration would be for them to be 20. That would be what I would like Torvine social workers to have caseloads of 20. Yeah. They're currently 24. When I wrote this, they were 25, but they've gone down now by 1. So 24.
Okay. And on page 5, the needs of social workers to record casework, consultations and decision-making about risk issues has been reinforced. How is this being monitored, and what is the percentage improvement?
I don't think I could give you a percentage improvement here and now. What we've done, I think I said in a different place, we've got a document now that we've embedded, which will mean we'll be able to report, you know, pull things out of the system, if you like, to report on sort of risk management. The decision-making about risk should be incorporated into that. What we found through the inspection, and this is one of the sort of positives about inspections, is that you learn from it, and you can actually reflect on your practice and do something different. And what the inspectors found is that, you know, there wasn't that consistent evidence. So we thought, well, how can we make that happen without putting loads more work on people? How can we evidence what we know that we're doing, but perhaps we're not doing it consistently enough? So by having this sort of document, it sort of, if you like, compels social workers to identify exactly what are the risks, what's the mitigation for the risk, and that is on the system, so anybody accessing the system, any other professional, can see what the risks are and how they're being managed. Equally, when we're inspected, that can be, you know, identified. Instead of us, you know, looking around, having to go right through the file, it's easily pulled out. So hopefully I'll be able to sort of give you some better data on that as we get to the end of the financial year.
There's a specific question I want to ask you, but I'm just referring back to what you were saying just now. Do you feel that your IT problems are now resolved with DRAG and so on?
It's always a challenge, isn't it? Because IT changes, and, you know, I'm not sort of saying that we've got any major problems right now. Obviously, we're looking to the next phase where there'll be a different system. But you know, things have been okay. We haven't had any sort of major problems of late.
Good. So you feel your evidence base is there now.
Yes.
Good. Services for mental health of children and young people, I know can be problematic. Do you feel it's moving forward in a positive way or otherwise?
Well, there's going to be another review of CAMS, and I happen to represent the All Wales Heads of Children's Services on some mental health related groups, so I've been able to sort of input myself and say, you know, what is important is that we don't just have a review and nothing happens, that we have a review. And one of the things that I suggested is that we stopped using the term CAMS because it had negative connotations, and that's not fair because, you know, CAMS professionals work incredibly hard, and, you know, it always seems to be, oh, well, it's, you know, it's down to CAMS, and that's not true. You know, it's something that does need to be shared. There is a conference in the All Nations Centre, which is going to, the theme of which I think is going to be about everybody needs to work together to sort of better facilitate meeting the needs of the mental health needs of children and young people. So it's free as well, so I'm hoping to go to that, and you know, to sort of learn what the sort of wider perspective is. So. But it is a challenge. It's a challenge because there is a very small amount of resource for a large demand, and there is a lack of understanding of what constitutes a CAMS referral in the wider, you know. So everybody needs to sort of have a better understanding, I suppose.
No, I just want to ask you open-ended question.
How do the actions improve outcomes for children in the inspection report? How do the actions improve outcomes for children and young people, and how will you be measuring this?
Do you mean as a sort of general, you know, from having the inspection, how do we actually get to the point of improving the outcomes for children? Yeah.
And the measuring is very important.
Yeah.
Yes.
Because the inspection is thematic, that helps us to sort of draw together groupings, if you like. So that helps us as a service area understand what it is we actually need to do. And, you know, it's challenging having an inspection, and I'm conscious that my lead inspector is here. And it is, but it does help us to focus on what we need to get on with. So in terms of, you know, so if we do what the inspection team sort of recommend us to do, then it should stand to reason that we've got better evidence, and that in turn would give us better outcomes for children. Demonstrating that is, you know, a very difficult thing to do, because obviously there are only sort of certain points in the child's life that we can say, okay, those outcomes, you know, those are much better than they were. We'll never know what they would have been if we hadn't done anything. We can only sort of aspire to the here and now, and hopefully that the child sort of actually achieves what the sort of goals that they want to, and that everybody around them wants them to achieve. We measure it, I guess, by all our PIs and the range of things that we've got that look at sort of evidence in everything that we do. And then we've got targets. Have we improved, or are we not meeting our targets? You know, all of those things are sort of a fundamental part of our work. Children's services social work is quite highly regulated, quite well inspected. Everybody looks at it. Everybody looks at everything that you do. We've got 47 performance indicators, some of which I think personally don't tell us very much at all, and some of which, you know, they are indicators, indicate that this may be something we need to improve on, or maybe something that we're doing really well on. It is a complicated business. It's a structure, it's a system that we're very much part of. And I'm not going to say it's a perfect system, because I don't think that it is a perfect system, but it's a system, and it's better than not having a system, because at least it helps us to understand areas that we need to, you know, actually we're not doing anything there. We need to be doing something. And it's, to me, the best sort of the best way that we can evidence things is by knowing where our deficits are and what we need to be doing more of. And I would, always hope that an inspector, an inspection team come in and they're able to sort of highlight to us, you need to be thinking about this. And I don't see that as, criticism. I see it as okay. We need to look at this. And maybe I can come back and say, well, I disagree with you there. There were a couple of things in the inspection report that I didn't feel were fair. But those are things that I, can do and will discuss with my inspector, at our regular meetings to sort of say, well, tell me more about what you mean by that, because I feel we've done a good job, so I hope that answers that.
I think it's something that we're all very conscious of, that at many policy seminars, at scrutiny meetings, and also and particularly joint scrutiny, when we're looking at how we measure, how improvement is measured and so forth. It's a big question for all of us that we're trying to work out. No, what are we comparing? How do we measure improvement? What is improvement? And I think that's an issue for all of us, that we want to do a better job. Both you and us as councillors want to do a better job, and we're trying to work out, well, how do we measure that we are doing that better job, so that we can show it to business. Say, we're doing a better job. Okay, show me how. And I think that's something that we're all conscious of.
Actually, one of the key things that I suppose it illustrates that is the number of children that are looked after, because that is a double-edged sword. Because I am absolutely confident that there's no child currently in the care of Torvine that shouldn't be there, that could be anywhere else, and yet our number is high. It's one of the highest in Wales. So some people would think, well, that's very negative. Why are there so many children in care? So would it therefore be seen as a better thing to leave children in the community at risk? I don't think it would. Equally, you don't want to be intervening in families where the children don't need to be in care. So it is that balance, but it gives out a sort of a negative image that, oh, well, look at all those children, what's going on there, that sort of thing. And these are discussions, again, I have with my inspector, about that, because obviously if one or, a couple of authorities are very different to others, then that raises questions, doesn't it? So.
Ruth, can I just, as the last question, unless anybody else has got anything to ask. Since you produced the action plan, can you tell us what are the main things that have happened since you produced this action plan? How has it improved things?
Well, actually, Chair, it's due for review at the next meeting, so I haven't got that at my fingertips. But I suppose a couple of the things that I feel were really pertinent were the fact that there were some changes that we were able to make really quickly so that we could get straight on. And that was, one, about having the risk document, two, about altering how we record things at Complex Case Panel, which reflected, exactly what the inspection team said to us. Because when you're in it, you don't always see it. And when someone comes in and asks, well, what about this? You think, oh, yeah, actually, we haven't got that. It's not readily available. And just by making a couple of changes to how we record things, we are able to sort of, for example, ascertain what's the wishes and feelings of the child straight away, instead of having to search through the file to find it. Just little things like that. Those little tweaks have made a real difference. I think one of the big things for me is the comments around the independent reviewing officer, and I haven't read the national report yet, but I anticipate and expect that to be featured in the report. But I'm the representative of the All Wales Heads of Children's Service on that, and I've already had correspondence with the Deputy Chief Inspector about how we can utilise the All Wales Heads of reviewing officers, independent reviewing officers, to do some work about how we move that forward across Wales. So that, there's work ongoing, and the agenda never slows down, really.
So, from what you're saying, are you happy with the progress to date since the publication of this report?
I'm happy today, but when I read the national report, I might have a different view. But I'm happy that we've moved forward, definitely, from a Torfaen perspective. Now I want to try and sort of, put that into the context of the national picture and see if there are any, if there are other things that we might need to consider.
Anybody have any other questions of Ruth before? Ruth, as always, thanks so much for coming and giving us a really comprehensive answers to all our questions. Thanks ever so much. What we're going to do now is discuss it amongst ourselves and come up with our recommendations. I think it's best if I ask you to leave now, if that's okay. Thank you. Once again, thanks ever so much for coming. Do appreciate that. Okay. Yeah. What we need to do while we'll wait for Karen to come back is just to, again, as we always do, come up with our recommendations that we wish to make. Can I just say while we're waiting, thank you so much for all the committee members for the way you interacted and questioned. I thought that went very, very well. Shall I go on to question 7 while we're waiting for Karen to come back? Or do you want me to? Yeah, okay. Okay. Shall we carry on then? Karen can pick up as we come back. Does anybody have anything major that they wish to recommend?
Yes, Chair. I think the two things we heard from both from Dermot and also from Ruth was about the relationship between this council and the health board. And considering that it's all get together, Dermot made it perfectly clear that he said that the contacts with the health board are not satisfactory. And then Ruth went into the detail and saying, well, we were meeting with people, and the thing is that sometimes within the health board, even that there was a lack of consultation, a lack of knowledge within the health board of the things that were going on.
Right, so to condense that then, is that you would like the executive member to investigate the relationship between the local authority and the health board?
Most certainly, yes.
Okay.
With particular reference, obviously, to the CAMS department, which isn't easy because it is a very restricted one as well.
Chair, I'm really annoyed that the CSSIW report, National Thematic Overview report, that we now are at this scrutiny meeting today, and only today it is being reported. I think it would have been nice that we could have seen that report as well before we did our scrutiny, because it might have
But I think she explained, though, that they cannot produce that report until every authority in Wales has actually been inspected. So therefore it's a sort of chicken and an egg situation. Do we scrutinise it now, or do we wait another 3 months? Which case it would have been an awful long time since the action plan was produced before we actually scrutinised the progress to date. So we felt, when we discussed it at the last meeting, it was important that we scrutinised it now rather than wait. And because the CSSIW report, we have no control over that.
No.
But
I think, to Chair, the point was made that, in fact, it wouldn't probably have impacted much on what we've done today anyway.
I think it's worth recording that I was very impressed with both Ruth and Dermot. They were saying that their working relationship in respect of looked after children was obviously very positive. And besides the physical barriers of them being in different buildings, which is not insurmountable, they were both very positive. So I think it's worth recording that I feel quite happy that that relationship is working well. I think you wanted to make a comment about working with outside agencies.
Well, linked in part to the health board thing, and I think other agencies. I think that's always a concern. That's always been my great concern right across. I mean, not just in this, but I think in the general thing, and also about how different authorities, their accountability, how they measure performance. Are we, and also, well, basically, are they talking to each other? And also where it's cross-border as well.
I think also I was particularly pleased with the CSSIW lady. She was very positive about everything she said about Torvine. In fact, it was I couldn't find anything negative that she said. And Ruth wasn't in the room then, so she wasn't saying it just to butter up Ruth or anything. I felt quite reassured by that. CSIW seemed to be happy that they were happy with the inspection, the preparation for the inspection, and they were happy with the action plan.
I think, too, that was interesting, given what Ruth said about the preparation for the action plan. It obviously does require a lot of thought, but then any inspection preparation does. And it does mean that staff are on top of what they're doing. I think what was interesting as well, we had the perspective nationally from the inspector, although she is working locally, but it's important to remember, and Ruth brought it out, that she is engaged with professionals across Wales as well, in terms of the work that she does and the different bodies she sits on. So that does help to bring a perspective then into the work that Torvine does.
Just a few points that I've got in my notes that you may want to consider. Dermot spoke about clarity of referrals to the CAMS service. That was also a point that Ruth brought out as well. So you may want to think about a recommendation to work on that area, work on the clarity of referrals to that service.
Yeah.
And also, Councillor Taylor brought up the points that there was no action dates in the action plan. You may want to consider asking for those to be added so it's clear when implementation dates are due.
I want to go back to the visit that we had down at the football factory. I don't think it was a very good visit that we had, very poor actually. And I wondered whether there was something that we could recommend to Dermot or to that organisation that we can you know, do something about that. Like, you know, so I got to be honest, I think it was, I go to most of them, as you know, and I think it was one of the worst that we've been to.
I think, yes, following that report, I've been sat down thinking, this isn't the best way to do it, because we didn't. And that was 90% our fault. And I'm quite happy to take the blame for that, because we should have structured it differently. And we've been looking at that. And in fact, I can sort of hand over to Helen, because we had been talking about that.
I think that for the committee, I think we also be looking at the way we engage with children and young people. So if you would like to recommend that you work with your support officers to come up with a different method of engaging with children and young people, and then we can also work with the social care professionals so they can give us their views as well.
I think, personally, the model we used when we looked at the leisure centre, when we all went off on our own and talked informally to people, I think that format would have worked much better rather than us sitting round in a very formal environment. So I think what we'll do in future, we will take that on board and we will look at it and we will talk to the social workers and say, well, how do you think we should do it to get the maximum out of it? Because I do agree, we didn't get what we wanted to from that meeting.
Chair, I think we done better outside the meeting, because we had a photograph taken with them and things like that, you know, and they talked a lot. They talked a lot more to us.
No, did you want to come in?
As you said, Chair, I'm thinking back now to, I think the first one I went on, which was when we went to up to the school to talk about the family focus. And the thing is that then we were dealing with it in a professional way, because we were dealing with the teachers and also then dealing with the people from Family Focus. And I think it worked in that way. But again, because we're not dealing with, we're dealing with those who are with the customers, for want of a better word, which was, I think, was certainly the case in our visits to the leisure centres.
Also, there was Ruth pointed out that the relationship between education and social care was as good as it could be whilst they're in separate service areas. Is there anything you'd like to comment on that?
As I said, we could actually recommend that the executive member looks at co-locating in the same building. That would be ideal, but we understand we're not living in the ideal world. So, but we can make a recommendation, but we understand the practicalities of accommodation and costs.
And I think too, we're aware, basically, if you think in terms of education, schools are outstationed. So you're going to have difficulties. At the moment, they're just across the road, the two services, so at least it does make it easier, perhaps, than when they were up at police headquarters.
Exactly. Anything else? So as long as sorry,
one other thing, just to add on that, is a relationship with because so much responsibility is with the schools themselves. How do we is the relationship between the departments with the schools themselves on looked after children, because so much of looked after children is actually directly comes under local management of schools, and how those relationships.
Can you condense that down into a recommendation?
To manage the relationship between the schools and the social care, how that's managed.
Okay, thanks. Are you all happy to do as we've normally done? Helen and I will work on the actual wording of the recommendations. I will email them out to you and give you 4 or 5 days to come back with any comments, and then we'll send them off. Everybody's happy with that?
One question. I didn't attend the workshop that that the other councillors went, but what I was concerned with, Dermot said that, these children are, very disturbed and a lot of complex issues along with them. Now, when you went down to speak to these children, you know, what level of engagement had there been with social services before they were put in a position of talking to you?
No, that wasn't the issue. The issue we had was the environment we were at. There was a number of young people, and then we were sat around, so therefore it was very much like this, a question and answer, whereas the young people, there was one guy who was very actively engaging with us, and the rest of them, whenever we asked a question, we just got a yes or a no, or we didn't get anything. And yet, when we went outside, when the guys were having a fag before they started playing football, they were really chatty because it was on a one-to-one, on an informal basis. The problem was, and I take full responsibility for it, we were in a semi-formal environment, and that's where the problem was. It wasn't the problem of the young people engaging with the social workers. That wasn't a problem. The problem was the environment that we were trying to engage with them. And as I say, that's my fault.
Well, no, Chair, I'm sorry, I disagree, it's not your fault. What I am saying is, how long had the children been in care, been monitored and supervised?
It was a cross-section of all people. And quite correctly, I think, we didn't want to go into that. We didn't want to go into their own personal circumstance, because I felt that would have been wrong.
No, but perhaps you're not getting what I'm saying. I'm saying, how long has this child been in care and we'd been looking after it before social workers had picked on those children to meet us? If they'd only been in the care for a week...
No, sorry, can I... There was a complete range. Some that had been there for weeks, some had been there for years. Okay, shall we go on to... So we've got that. We will come up with the recommendations and I'll email them. Go on to agenda item 6, summary of executive decisions on page 25. Again, we'll go through these again. Page 25, 26, 27, 28 blank, 29, 30, 31. The only thing we can do on these is just to accept them. Okay. We now have to go on. This will be closed.
Discussion on the item.
Discussion on the item for the next meeting. Helen?
Okay, the next item for the next meeting will be the review of the Adult Services Duty Pod and whether it's meeting the Adult Services expectations.
I think, if you remember, we've had this to look at for over 12 months now. And I think it will be a really interesting thing because it's how I envisage it happening. Each one of us individually could actually elect to spend a couple of hours sat with the duty pod, so we individually, not as a group, individually see what they do, experience the problems they're having, and then we can bring that back to the scrutiny, because we really need to scrutinise to see whether this is actually working or not.
So can Helen or Karen arrange a rota for us, please?
What we'll do, we'll come out to you with dates and times, and I'll ask each one to say, yes, I can do Tuesday morning, 10 till 12 or whatever. But we will give every member of the committee the opportunity to sit down for a period of time, however long they want, with the duty pod prior to the meeting.
I'll liaise with the service area to make sure we choose the best method so it doesn't disrupt their working practices.
This is the point where I have to exclude the press and public, and can I thank those that are watching on webcast for taking the time to watch our committee meeting this morning. Thank you.
Chris?